Good evening, everyone. We're just going to give it a couple more minutes to make sure people have a chance to log in before we get started. Okay, I think we'll go ahead and get started. Good evening again, everyone, and thank you all for taking the time to join us for our third Sienna, BC Resident and Family Town Hall. We recently marked 1 year since the beginning of the pandemic, and we now find ourselves in a critical and complicated juncture. While the vaccine rollout and slowing numbers of outbreaks signal hope, new variants are posing additional concerns that may prolong the pandemic. And as we have before, we wanted to provide you with the opportunity to hear the most current information directly from our medical professionals and team, and to get the answers to your most pressing questions. With so many participants on this webinar, we were not able to open it up to live questions. However, we did provide you with the opportunity to submit questions in advance. And thank you to everybody who did that, because that was very helpful in shaping the content for the town hall this evening. We'll start the meeting with updates about current COVID-19 cases, variants of concerns, and the vaccines, as well as an overview of what we're doing at Sienna to manage the pandemic. And then we'll get to your questions. Again, as we did before, we took the most frequently asked questions from the survey and combined them into themes, hoping to touch on all of the questions that are most important to you. Unfortunately, we can't answer individual questions related to your loved ones in our residences or about your own personal health situations. So we do ask if those are the questions on your mind, that you please reach out to your residence team or to your family physician for those answers. Now I'd like to introduce to you our guests. Dr. Andrea Moser is Sienna's Chief Medical Officer. She's a family physician with a focused practice in the care of the elderly, a certified medical director, and an associate professor with the Department of Family and Community Medicine at the University of Toronto. She has an extensive background and interest in the care of seniors, with a focus on long-term care medicine, and has been an advisor to the Public Health Agency of Canada, among other organizations. At Sienna, Dr. Moser is focused on enhancing the medical and physician support provided to our residents, as well as supporting our management of the COVID-19 pandemic and preparing for any potential future outbreaks. We are also joined by Dr. Allison McGeer, Chief Infection Prevention and Control Consultant to Sienna. Dr. McGeer is the premier infection prevention and control specialist in Canada. She's a professor in the Department of Laboratory Medicine, as well as the Department of Pathobiology and Public Health Sciences at the University of Toronto. And she advises multiple levels of government on pandemic prevention and management, including Canada's National Advisory Committee on Immunization and the Infection Control Subcommittee of Ontario's Provincial Infectious Diseases Advisory Committee. With Sienna, Dr. McGeer has played an important role in guiding our teams to effectively manage outbreaks and prevent further spread of the COVID-19 virus, as well as preparing sustainable plans for the future. Dr. Anthony Tran is also with us tonight. He is the medical director at several long-term care communities in the Lower Mainland, as well as being an experienced hospitalist and family physician with a special focus on geriatrics. Dr. Tran is also the physician lead working with the Fraser Health Authority on their pandemic response for long-term care and assisted living. In addition to our physicians, we're also pleased to have our senior leaders for British Columbia with us tonight. We have Lisa Kelly, our Vice President of Regional Operations in Long-Term Care. Lisa has worked in the BC healthcare sector for 17 years and is a longtime advocate of seniors care. Allison Howard is our Vice President of Operations for Retirement with more than 14 years overseeing all operational aspects of seniors and retirement living in BC. So now let's get into the session for this evening, and I'll turn it over to Dr. McGeer to begin with her presentation.
Thank you very much, Maureen. Okay, so I'm going to quickly go through what's happening with COVID cases in British Columbia and what's happening in long-term care. So the first piece of good news I don't need a slide for, which is that outbreaks and cases in long-term care facilities have essentially vanished all across the country, in fact, all across the world, in association with the institution of vaccination programs. So it's been really quite miraculous to see that the number of outbreaks and the number of cases and residents has gone down. And in the last 3 weeks, we've also had the opportunity to watch what's going to happen as the variants, which I'm going to talk about in a moment, take over. We were all a little bit worried that when the variants came, that it would get us into trouble with outbreaks starting again because they're more transmissible and more severe. And that has not happened with the current variants, which is amazing. However, while things are much, much better in long-term care and retirement homes, we have a significant problem with COVID in the community. I was about to say all across the country, but of course it's not all across the country. Atlantic Canada is just fine, thank you very much. But the rest of us are definitely having problems with the variants. So this is an average daily COVID-19 cases per 100,000 persons in the provinces across Canada, and you can see that the leading provinces in the last week are Saskatchewan, Ontario, and British Columbia. We were doing a little better in Ontario up until last week, but we're now rapidly moving past British Columbia. But British Columbia is also, next slide, as you know from Dr. Henry's move yesterday, having a significant increase in the number of cases. So here's our peak over the Christmas season, and then it came down nicely. But for the last 4 or 5 weeks, cases have been trending steadily upwards. And that's despite the fact that we have not changed what we're doing that attempts to keep transmission of COVID under control. So the logical question is, okay, we were doing fine, and now we're not doing fine. What happened? And what's happened to us is variants. Next slide. So coronaviruses, a little bit like influenza viruses, change over time, right? So the reason you have to get a flu vaccine every year is because each year influenza is different. And coronaviruses are like influenza viruses. They change regularly. We got a little fooled by SARS-CoV-2 because for the first 9 months of its existence, not very much happened. And we were all just about to breathe a sigh of relief and say, okay, maybe this coronavirus is different. Maybe it's not going to happen. When all of a sudden, these new variants started to appear. And there's 3 of them in particular that we're starting to see globally and in Canada that cause problems. So the first of them is we originally named them after countries. And, you know, we decided about 25 years ago that we were never again going to name viruses for the countries they were first identified in, because we found out that that's seriously stigmatizing for the countries. And we all, right up until December in the pandemic, we managed it, and then we just had a relapse. And we couldn't think of what else to call them. So now we're stuck because you can either call them by their name of the country they originated in, which is least comprehensible, or you can call them by their virologic short form, which is kind of incomprehensible. So it's not very satisfactory, but it's what we have to live with at the moment. All of these variants have a number of mutations in the spike protein, the protein that sticks out of the surface of the membrane and is what our antibody responses to, and is what binds to the cells of your respiratory tract to cause infection. So they're different from the baseline virus. We know the most about B117 because it originated in September in the United Kingdom, and the United Kingdom's just done a stellar job of tracking things and looking at what's happening to disease, much better evaluation of the progress of disease and changes in disease than almost any of the rest of us have been able to do. So with B117, we know that there's increased transmissibility. The changes in the spike protein make it bind more easily to the respiratory tract. And so it's about 50% more transmissible. So imagine that we're at a stage of having one new case for each case of COVID with the old variants. With B117, now instead of having one new case for every index case, you get 1.5 new cases for every new case. And because growth is exponential, that means that you predictably, interventions that control the transmission of regular variants of COVID don't control B117 as successfully. Also seen a shift to younger adults and more children getting sick with this variant of COVID. We don't really understand why that's happening, but it's very clear it is. And there's, as I'll show you in a moment, between a 60 and 100% increase in severe illness with this disease. So it's not just more transmissible, it also makes people sicker, and it makes younger people sicker. The good news about it is that vaccines work, and we've already seen that. It's despite the fact that in Ontario now, we're at about 100%, in British Columbia, we're about 50 or 60% of cases are variants, and still no outbreaks in long-term care, because the vaccination of residents and team members in long-term care is protecting them well against this variant. The newer ones coming behind, we know less about. So B351 and P1, both, we know they both have increased transmissibility, but we don't have a good idea of how much. They appear not to cause different illness, but we're not absolutely certain about it. What we're really worried about with these two is that the vaccines may not protect quite as well against them. It looks as if the levels of antibody that you get by vaccination will be enough for protection, but they're definitely not quite as high as what you get to the old viruses and the B117 variant. So there's reason to be worried that particularly among the frail elderly, among immunocompromised patients, people who don't respond as well to vaccines, that we might see reduced protection by vaccines. And that's making everybody a little bit edgy because clearly these variants are increasing all around the world, in fact, but certainly all across Canada. Next slide. So just to show you, and I apologize for the complexity of these slides, but I just want to show you for a moment what's different about the disease we're seeing with variants. We don't have data from a lot of countries. Most of it is from the UK. And because we're a little bit ahead of BC in terms of variants, this is a bad place to be, okay? You should be really happy that you don't have as many variants as we do. Here's the data. So this is what's called a forest plot, and it's comparing disease due to the B117, the UK variant, against regular disease. And if these squares overlap one, then the two are of equal severity. If they're to the right of one, then that means that the new variant, the B117, causes more severe disease. So what you can see is that in all two countries have looked at this, Denmark and Ontario, you're 60% more likely to be admitted to hospital if you get B117 as compared to the old variant. You're twice as likely to be admitted to the ICU, and you're about 50 or 60% more likely to die if you get infected with this new variant. And on the right-hand side, you see data from Ontario just looking at what happens to illness in the ICUs because of this. So in December, that's before we had the variants, in the last wave, 30% of the people in our intensive care units were under 60 years of age. As of the last week in March, when we were at about 80% variants, 46% of people with COVID-19 in our ICUs were under 60. So you see this real shift to bad disease in younger people. Many of those people survive, but one of the problems is they can spend a very long time in the intensive care unit. So it puts a really strong added pressure on our intensive care unit and hospital capacity when we see these cases. So it's not just that we're worried about the increase in cases, we're worried about the greater severity in cases and the shift to younger ages that makes these variants more dangerous. Next slide. Okay, so that's the bad news. The reason that BC has ordered a circuit breaker, the reason we're going back into some form of much more stringent restrictions in Ontario tomorrow, the reason Quebec is about to change and Alberta looks like it's about to change as well. We all have the same problem, which is that we need to be doing more to get control of transmission of variants. The good news is that our vaccination programs are moving as quickly as we can. We're pretty close to keeping up with the supply of vaccine coming in, which is amazing considering that there's uncertainty every day about exactly where vaccine is going to come and what you can do. So now we've given about 5.3 million doses of vaccine. So that's 9.8% of the population has had at least one dose of vaccine. And there've been about 14 doses administered per 100 people across the country. In both Ontario and BC, that means more than 80% of people over the age of 80 have been vaccinated. In Ontario, we're obsessed with the fact that we have 20% to go and we think we should have done everybody. And that was my immediate reaction is, oh, merciful heavens, we still have 20% to go. And then I thought, wait a minute. It's an adult vaccination program and you've been at it really with enough supply of vaccine for 3 weeks and you're complaining about being at 80% of people vaccinated. The vaccination is good news, bad news. It would be miraculous if we could just do everybody tomorrow. But we really are making very significant progress in protecting people. You can see, however, that we still have a long way to go before enough people are protected to help control the spread of the new variants. So we are going to be in this really tough position in the community for the next 4 to 6 weeks at least, where we don't have enough vaccine delivered to be able to slow down the spread at all. And we're going to have to slow it down with restrictions on mobility and lockdowns to things, which is just really hard to face when it feels like we're so close to things getting better. Next slide. So one quick note about what's happening with vaccines. The vaccines are really truthfully a miracle, okay? In November, I didn't think we were going to have any vaccines for use until the beginning of April at the very earliest. The fact that we got them in December, the fact that we had them out to long-term care in January is nothing short of miraculous. But we are moving very quickly, and that means you run into these bumps of confusing and difficult things. And this week and last week is the AstraZeneca vaccine. Next week is probably going to be something else. Okay, so there's 2 things about the AstraZeneca vaccine. The first is, does it work as well as the mRNA vaccines? Next slide. It's really hard to figure out the comparison between the randomized controlled trials. In the randomized controlled trials, it looked like AstraZeneca was maybe not quite as effective. But in the analysis from the United Kingdom, looking at older adults, they compared 1 dose of Pfizer. That's just because you have to wait a period of time. So they wanted to do the analysis quickly, and they did it after the first dose. And 4 weeks after the first dose, you can see that the protection from both vaccines against any infection with COVID was 60%. It climbed to 70% by 5 weeks. And in addition, if you did get COVID, there was a 60% reduction in your risk of being hospitalized if you were vaccinated. So that translates to both of these vaccines provided about an 85% protection against hospitalization, ICU admission, death due to COVID in adults over 70, and the numbers look almost exactly the same. So these are both very effective vaccines, and you get a little bit of additional protection from the second dose. You probably get longer protection from the second dose, but you get really good protection from the first dose. Next slide. Now, the second issue with AstraZeneca has been the issue of blood clots. And when you start using a vaccine, you are always in a situation where you've done the phase 3 clinical trials involving usually somewhere between 15 and 35,000 people. Those people get followed very carefully. You find out about common adverse events, but you can't find out about really rare adverse events until you've done very large trials. So we're through, we've given a lot of mRNA vaccines. We know what their adverse events are. The only serious adverse event is anaphylactic reactions. But last week, we found out about blood clots that are apparently associated with the AstraZeneca vaccine. They're still rare, okay? So the best estimate in my view is somewhere between 5 and 9 per million doses. That's about the same risk of anaphylaxis with the mRNA vaccines. There is a bit of a difference between the two, which is that these blood clots that are apparently associated with the AstraZeneca vaccine can have are difficult to diagnose, and they can have very serious consequences. Anaphylaxis usually, even if it's severe, can be successfully treated and people do very well. But these reactions, even though they're very rare, can result in people dying. So it's really important that we understand them and that we don't use the vaccine in places where it causes more risk than benefit. So people are still working hard on figuring out exactly what the mechanism is, why it's there, whether for sure it's associated with the vaccine. If it's the vaccine, is it a batch of the vaccine? Is it this particular vaccine? Is it adenovirus vector vaccines in general? Okay, so lots of questions, and the answers will come over the next few weeks. But in the meantime, we have a COVID pandemic, and people are also dying from COVID, and it's very clear that for adults over 60, this vaccine, these adverse events are really rare, and vaccination is a significant benefit in the short term to protect people from COVID. For people who are under 55, and all of these cases in Europe that have been identified occurred in people under 50, actually, it's not as clear that the benefit is definitive, because you can get very seriously ill from COVID if you're young, but it's really unusual to die from it. And because of that level of uncertainty, NACI and most of the provincial governments have said we're not going to give the AstraZeneca vaccine to younger people, at least until this is sorted. So we're going to hear more about it over the next 2 or 3 weeks while we sort it out. But in the meantime, it's still an excellent vaccine for those of us, me included, who are older adults. Next slide. Okay. So now, what's our problem in BC in particular? We've been enormously successful in long-term care outbreaks. As I said, despite the UK variant, these outbreaks have not restarted. And so there's really good reason to reduce restrictions and to let people get at least some of their life back and try to return to being able to see people and do things. But at the same time, there's really significant community spread in British Columbia that has to be fixed. And so BC's gone into a circuit breaker with added restrictions in the community. So we're doing this, releasing restrictions in long-term care, increasing them in the community, which feels kind of odd, okay? Good reason for it, but it still feels odd. And the second thing we're worried about is that those two variants, the South African and the Brazilian, are still quite uncommon all across Canada, but they're increasing, and we're not sure what their impact on long-term care is going to be. It's not impossible that that vaccine will not protect long-term care residents completely. And so we really need to be keeping up our guard about what's happening with those variants and what the impact might be on our frail older populations. Next slide. Okay, so I'm going to go really quickly through the balancing act that people are trying to run. And then other people are going to talk in more detail about what's going on. So what I want you to do, think about this, is try to think about this is what I think of as a harm reduction approach. Okay, it's trying really hard to balance the fact that there's still a risk of COVID, that we don't want to make things worse in the community, but that we do want to restore what we can in the way of social interaction in long-term care. So everything is trying to hit the right balance. For instance, we're saying that resident interaction with each other, so within the bubble that is now a long-term care home or retirement home or assisted living facility, residents can interact with each other. In long-term care, because we can, that restriction is to neighborhoods. So we're not saying you can do everything and be with everybody. We're trying to keep it to some degree limited while still allowing people to interact with each other. A piece of that is about being able to do contact tracing if something goes wrong. So you'll still find, bookings for meals and times and working on cohorting. Visitation's going to open, but the limits are 2 people at a time. Those people are coming to visit one resident, and it's either in the residence rooms or suites or outside. So if somebody does come in who's incubating COVID, asymptomatically infected at the time, doesn't know they're sick, the exposure is limited to that one resident. And where possible, visitors outside, because we know that interactions outside are safer than interactions inside. Physical contact is back, which is great. Okay, the limits are with appropriate infection prevention practices in place, and you'll get all the details on that. And the email is coming in instructions when you get to long-term care. Outings are in. People can go on outings, but remember, when you're out on outings, that the circuit breaker rules apply to everybody. So there's still going to be substantial restrictions on what you can do when you're outside, but certainly getting outdoors into parks, being able to go for a walk, see things, that's all fine. And all of this happens while working really hard at maintaining infection prevention control. So that's screening and hand hygiene and masks and physical distancing between. So you come in to see a resident, contact with that resident, but not contact with other residents, maintaining distancing from staff, maintaining distancing from other visitors. So trying to keep all of the rules in place that will protect people while allowing social interaction and contact back into the lives, because all of us understand that that's critical. And I'm switching over to Maureen, someone. Oh, it's okay. I think people, this will be recorded and available later. So if anybody's worried about accessing vaccine, it's one of the really good things about BC, if you're from Ontario, is that you've got it so much better organized than we do in Ontario. So I don't think anybody's having trouble. But it is a useful thing to have on hand, I think, in all homes, and for people to know, because despite, I think, public health's best effort to get the information out to people, there's still lots of people who are having a little bit of difficulty figuring out how to get access to vaccines. And the more people we get vaccinated, the sooner we will all get out of this.
Great. Thank you, Dr. McGeer. We'll now turn it over to Lisa just to provide a couple of updates on our preparedness at Sienna for Wave 3 and some of the measures still in place.
Great, thank you. Thanks, Dr. McGeer, for touching on the easing of the visitation restrictions. Our families and friends on the line will have received an email from the retirement and long-term care divisions. And in that email, it does provide you with much more in detail information about the visitations and how they will happen when you come to the care community or the retirement community. I'd like to just touch on a little bit about our Wave 3 preparedness. So throughout the year, we have really continued to prepare for future waves. And I'm really pleased to share with you today our vaccination rates. So you'll see on the slide that at our care communities, The residents are now vaccinated to 90% and 71% of our team members. In our retirement residents, we actually have a 96% vaccination rate with our residents and 80% with our team members. Some of our other wave 3 preparedness has been continuing with really a very robust active on-site screening process. Of course, we have ample supplies of PPE. We continue with our extensive infection prevention and control measures and enhanced cleaning. And we're continuing to work with our experts like Dr. Tran, Dr. Moser, and Dr. McGeer, as well as partnering with the ministry and local health authorities. Next slide. Okay, so as we are welcoming everyone back, we're very pleased to welcome you back, but we are going to continue to ask that everyone be very vigilant with the infection prevention and control measures. So when you arrive back to visit the care community or the retirement community, you can expect, of course, that very robust screening process. You'll be educated to the proper use of PPE. We're going to ask that you not wear a cloth mask, but instead we will provide you with a surgical mask. We will ask as well that you refrain from bringing any food or drink to your visit, but of course we're still welcoming those care packages for delivery. And adhering again to that single point of entry, that hasn't changed. So we have that single point of entry and asking that when you come to the site that you go directly to or from the residence room or the area that you're visiting. And if you need assistance, please just press the residence call bell. We'll be happy to come to the room and assist you from there. One last note really is just that, should we have the misfortune of going into an outbreak, according to the ministry directives, social visiting will be suspended at that time. Okay, thank you very much for helping us adhere to the infection prevention and control measures.
Thanks very much, Lisa. So now we'll move into your questions. And again, we did take all of the questions that you provided in advance, and we tried to collect them into themes so that we hopefully touch on most of them. So the first set of questions is about vaccine safety and efficacy. And so I might go through these one at a time so that we can make sure that we do answer them thoroughly. So BC has extended the time frame between the doses. Will it still be as effective? Dr. McGeer, can you respond to that, please?
Yeah. So there is in an ideal world, we'd be giving everybody 2 doses on schedule because there is a relatively small difference in the efficacy between 1 doses and 2 doses. So remember I said 85% for 1 dose. It's about 90 or 95% for 2 doses. So 2 doses are a little better than 1 dose. But we have a shortage of vaccines at the moment. So very clearly, if you can protect 2 people to 85%, or 1 person to 90% and 1 person not at all, because you only have 2 doses of vaccine, we're better off to give 1 dose to everybody. So that's what we're doing all across the country, in fact, across most of the world, because we know it'll get us the best protection for the most people. The best analogy I've heard for it is like your first dose is your meal, and the second dose is your cupcake for dessert. And what public health is asking us to do is give up the cupcake so that somebody else can eat. Now, that doesn't mean that we're not going to get second doses to people as soon as we can. The good news is that it doesn't matter how long it is before doses. If you put doses of vaccine too close together, you don't get as good an immune response. But if you separate them further out, it's okay. The response is actually a little better if you wait longer. So having that second dose separated out does not mean you need extra dosing, doesn't mean you won't respond as well. The only concern with extending the dose is that if protection wanes in between like the 3rd and the 4th month, people might not be quite as well protected at that time. And that's why we're watching so carefully, okay, all around the world. We're looking to see if we can identify an increasing risk of infection in people between 3 and 4 months, because the moment we identify it, we'll be moving back to getting second doses into people, into the most susceptible people as quickly as we can. I think actually that we're getting enough doses into Canada that we probably won't have to wait 4 months for the second dose, but we are just going to have to see how long it goes. In the meantime, though, it really isn't something you need to be worried about.
Okay. Thank you. And then the next question is about whether the vaccines are dangerous. You did talk a little bit about AstraZeneca and some of the recent findings there. Can you provide some insights overall with the vaccines, Dr. McGeer?
Vaccines, vaccines all have side effects. Vaccines are like medications. Nothing in life is completely safe, right? I can get up in the morning and slip in the shower and die from a head injury in the shower. That's an extreme example, okay? But all life comes with risk. So the question about vaccines is it safer to live without a vaccine in the setting of ongoing exposure to COVID, or safer to have the vaccine? And there is no question that on a relative scale, all of these vaccines are very safe, and definitively the mRNA vaccines are safer for everybody than not getting a vaccine at this point in time. For the AstraZeneca vaccine, very clearly for adults over the age of 55, it is safer to get vaccinated than not to get vaccinated in this setting. So it's not that vaccines are completely safe. It's not that they don't have adverse events. It's just that you're safer to get them than not to get them by a pretty wide margin.
Okay. And you touched a little bit as well on the effectiveness of the vaccines against variants. Is there anything more that you can add to that?
I don't think so. Just please
Okay.
keep your fingers crossed, okay? Good
Mhm.
against the UK variant, and we're hoping for the rest.
And last question here, is it safe for any non-vaccinated individual to visit a vaccinated individual?
So safety is all relative, okay? Nothing is absolutely unsafe and nothing is absolutely safe. Vaccinated individuals are well protected, but not completely protected. So any contact with anybody is a risk. Contact with somebody who's not been vaccinated is a bigger risk than contact with somebody who has been vaccinated, because those people are more likely to be infectious. So you've seen the release of restrictions. There's nothing in those rules that says that visitors coming in have to be vaccinated. So we are saying that it is safe enough that it's being permitted, because of course getting social interaction back is really important. But it's absolutely true that if everybody who comes into a home is vaccinated, that it is safer for everyone. So this is a plea for everybody who's a visitor in a long-term care home to get vaccinated, to try to make sure that all residents in care homes and retirement homes are protected.
Okay, thank you for all of that. Next slide, please. So with the vaccine rollout, why is the province so delayed in the vaccine rollout? I don't know if you have insight to that, Dr. McGeer, or if Dr. Tran might be able to weigh in as well.
I think we're pretty much the same across Canada, and it is absolutely true that the Americans and the United Kingdom and Israel are ahead of us in their vaccine programs. They did better than us in terms of planning, but I would point out to you, much worse than us in terms of controlling the pandemic before we get there. So everybody's got different marks on their scorecard, and we're better at some things than others. But really, it was about, a piece of it is about not having a vaccine manufacturing in the country, which we'll try to fix before the next pandemic. And a piece of it was just that we didn't manage to get high enough up on the list. We didn't order enough vaccine in quite the right way. On the other hand, vaccine rollout is going to expand really quickly in the next 6 to 8 weeks. So we're really only maybe a month or 6 weeks behind where we could have been. So it's not disastrous. It's really frustrating just at the moment, but it will be over soon.
Okay. And I think you've probably just responded to the next question around the shortage of vaccines. Any insight on whether other professionals will be able to administer the vaccine? I suppose beyond pharmacies, where it's expanding out to at the moment.
Dr. Tran may know more about what plans are in BC than I
Yeah.
do.
Yeah, so they just released the information about pharmacies being able to administer. So there's only been a few, I think there's only a few designated pharmacies have been appointed to do it so far, because they have to have the capacity to have the social distancing and a bunch of other criteria met before they are able to participate. So the province has already kind of predefined which of those pharmacies are available, and they've released the list of those pharmacies already. I don't know if we have ability to disseminate that list to everybody later.
Yeah,
but,
we can do that.
Perfect. So in terms of any other health professionals being able to roll it out in the future, like family physician offices, not sure yet. I think, we'll know as soon as you know. What they've been doing is releasing the information to the public at the same time as the health professions. So, unfortunately, we don't get any advance notice above and beyond what you and the public are getting. So anything that you're hearing, we're probably hearing at the same time.
Okay. And what about caregivers, Dr. Tran? Are you aware of when they'll be able to get the vaccine?
In terms of, are you talking about?
I think essential caregivers, I'm guessing, is the nature of the question.
Well, essential visitors already have been
They do, okay.
had the ability to get vaccinated since earlier on. So
Right.
if you're deemed an essential caregiver, you would be qualifying for that.
Already.
And you'll have
Okay.
to speak with the administrators at the care home, and they can help assist with that process.
All right, thank you. Next slide, please. So lots of questions on visitation and outings as well. Now, and I don't know, I might need to kind of go between Lisa and Allison a little bit, but is there a procedure for booking a visit or an outing, and should they do that in advance? Allison, can we start with you in retirement?
Absolutely. Yes, in retirement, we do ask that you book your visit in advance. We have a schedule set up for each of our retirement communities. We did have a system that was online. We understand that that system is going to be overwhelmed starting tomorrow. So we ask that you call the community where your family member resides, and they will be happy to book a slot for you. If you're visiting with a family member, you can visit in suite, you can visit outside, and at retirement, we do have designated inside visiting areas also. If I may just touch on the procedure for that also,
Sure.
If you are visiting, we do ask that you not encourage your family member to come and meet you. We're trying to reduce congestion in the lobby areas for infection control. So we will escort you to their suite or to the designated visiting areas so that you can meet them there.
Okay, thank you. Lisa, anything to add on your end?
Sure. Just in regards to how you book a visitation, the process will be as you have been doing in the past for any of your designated visits that we would have classified at that time, and as well for Zoom visits. So some communities do have electronic software that's been assisting with this, and others have been taking it through email. We are moving all of our long-term care communities to an electronic platform, so please stay tuned. Early into April, we will have that up and running. But otherwise, the care communities have sent out the details of how to book that visit. Thank you.
Okay, thank you. And is there, do you have any guidelines on the frequency of the visits, either in retirement or in long-term care?
Sure, I can take this one first, Maureen.
Sure.
So we are following the ministry guidelines, which ask that we have at a minimum of one visit a week for 60 minutes. We would love to open that up to more visits. We are just going to be taking it day by day and looking at the scale of what the requests are from our families. When it's looking at taking a loved one out for an outing, I see that's sort of the second part of that question as well.
Yeah.
Again, we would encourage our families to please just abide by the provincial health officer's order when it comes to outings, but we're more than happy to facilitate and work with that. You could please just schedule that in advance so we can make sure the resident is ready to go with you.
Okay. Anything else to add for retirement, Allison?
Just from retirement, we're just going to ask that you be patient with us. We know that you probably have a desire, there's multiple groups that wish to come and visit your family members. So we want to ensure that every single resident gets a chance to have at least one visit throughout that time. So we do ask that you bear with us as we work through this over the next few days and weeks, and we will hit a rhythm, I promise you.
Okay, thank you. Are there any limitations on visits if someone is from another province? Are either of you aware of that?
No,
So-
currently there's no, sorry, Doctor, I was going to say, currently there's no limitations for traveling from one province to another.
But the BC circuit breaker does actually impose limitations on travel. So because of the BC circuit breaker, all of us are being asked not to travel to British Columbia unless it is essential. So if there's a particular reason why it's essential, that's something to have a discussion about, but otherwise none of us are going to British Columbia for the next 2 weeks.
Right, thank you. Thank you for clarifying that,
Yeah.
Dr. McGeer. Certainly not an order, but a recommendation, a high recommendation.
Yeah. And then, okay, this is a bit technical, but for the 2 visitors plus a child, can the extra visitor be an adult child of the resident?
I can take this one. It's very
Go ahead.
clear. Yeah, the directive was very clear. It's 2 visitors plus a child. It's not an adult child, it is a child. So
Yeah,
up to the
Thank
age of
you.
19 years old.
okay. And will we be allowed to bring in takeout food? I think we've already addressed that. At least I think you touched on that. So the answer is the request is not to bring in any takeout food or drink containers. Can I stay in the retirement suite with my mom when I visit? I think both of you have said, well, whether it's retirement or long-term, that you prefer the visit takes place in the suite, in the room, as much as possible. Allison, did you want to elaborate on that?
Yes, I'm wondering if this question is regards to people coming and staying with their parent, because that has, particularly through the summertime, we're going to cross that bridge when we get to it. At this point, we're asking that we are able to roll out over the next few weeks and days these visits to ensure that we can address everybody's desire. And if you have a situation where you need to stay in one of our communities, please contact your general manager directly, and we'll assist you in working that through.
Okay, thank you. And the last is more of I guess, a comment and a question. I'm concerned this is too much too soon. Is it the right change? Dr. McGeer, I think you touched on some of that before as well. I don't know if you would mind going through that again and the balance here.
Yeah, I think, there's no question that for many of us involved, that it is really scary to reduce restrictions. You get used to them, and you know that they are effective preventive measures, and allowing more contact feels like you're just opening it up to the virus. But we also know from experience that it is really hard to release restrictions as quickly as you ought to at the end of the outbreak. You do kind of get embedded in your protective measures, and we don't release them quickly enough. So if we're all feeling it's a bit too soon, it's probably the right time. And so I do think that what you're hearing from us is that we are all supportive of being able to increase visitation and increase socialization, and do be assured that there are these layers of balancing in that. We are trying really hard to make sure that the screening is good and the social distancing remains, and that we're trying to put all of the levels of precautions in that can be put in, while still allowing people to have to get back to some social interaction, and out of the really severe restrictions that they've been in. But also be assured that, as this happens across the province, public health in British Columbia is watching this really carefully. And if there's any indication that we've gone too far, that we will go right back to where we need to be. This is not this is, as with everything else in the pandemic, this is a decision today about what the right thing today is. If there's any indication that it is wrong, then nobody's going to hesitate to change.
Thank you. Thank you very much. Next slide, please.
So just a comment on
Oh,
that.
sorry. Go ahead, Dr. Tran.
Yeah, I think, at the end of the day, the responsibility lies on all of us to make sure we're doing our part to make sure that this is successful and that there isn't any harm. So, how do we mitigate the risk? We each have our own responsibility to make sure we're following the guidelines that public health has put out, that we're limiting our own interactions outside of the care home to our, to our households and to the groups that public health has advised us to limit to avoid, risky behaviors and breaking those rules as a lot of people have done, and that's what's causing these outbreaks to happen. So, you have responsibility to protect your own loved one and those that they live with. So if you think that you may have been exposed or in a high-risk situation, or if you are feeling unwell, just stay home and, have a video visit with your loved one and come back another time when you feel that the risk is lower.
Thank you for that addition. Next slide. So just a couple of general questions that had been asked. Why is rapid testing not being used in BC? Dr. Tran, do you have an answer for that?
Okay, maybe I can try that. Okay, I think it's because you're smarter than we are in Ontario. Okay, I think there was room for argument about what kind of testing was being done in staff and residents in different areas of the country, and I don't know what the right answer was. But I do think we're recognizing that with really high vaccination rates now, that rapid testing is probably not very helpful in long-term care retirement, and we're probably going to stop it pretty soon in Ontario. So I think you should be happy that you're not doing it at the moment in British Columbia. One of the things that people tend not to think about is that the positivity rates have been really low, not zero, but really low. Even with a really good test, when the positivity rate is that low, about half of people who test positive are not actually positive. But if you test positive, right, then you end up with a PCR screen and you end up in isolation, and there's a whole lot of bad things that go with that. So it's not, rapid testing is not a uniform benefit. It's not just about how much money it's costing. It's also that there are some adverse consequences of using rapid testing.
Okay. And Lisa or Allison, can you
Sorry,
respond about? Oh,
sorry, just to get back to the rapid testing, my microphone was off there for a second.
Oh, okay. Sorry.
We're actually not that smart because they're going to be doing a pilot project in Fraser Health, a small pilot project doing the rapid testing. I agree, though, that at this stage it's not really that beneficial. Prior to vaccinations would have been probably the most a high yield use of that testing, but they weren't sure how accurate it was. So as Dr. McGeer said, sometimes there's a lot of false positives, which has a lot of issues with maybe causing shortages of staff, which would actually put our loved ones at increased risk because of when you're short staff, then mistakes happen and sometimes contamination can occur. So, there is going to be a small pilot project occurring. Will it end up going anywhere? My gut feeling is probably not, but who knows? I think, realistically, the vaccination is the route that's really going to be the most fruitful at this point.
Okay, thank you. And sorry, I missed you earlier. last question here is about volunteers being accepted back for visits or to support the residences. Lisa or Allison, do you have insight on that?
Sure, I do. You know, when we talk to our local health authorities, the response that we're hearing is that at this time they really want to sort of find that that balance between managing the risk and taking care of our vulnerable population. So at this time, we're being told there aren't any volunteers that will be accepted back, but they do regularly visit this, and of course with the Ministry of Health. So as soon as we hear anything different, we'll be sure to let you know.
Okay, thank you. That brings us to the end of the questions we got in advance. There are a couple I would like to try to address from the chat, if you don't mind. One question about whether dogs are allowed on visits, and if they aren't, is there somewhere that this can be escalated to? So Dr. Tran, do you have any insight on that from in BC?
Sorry, could you repeat the question again?
It's whether dogs or pets are allowed on the visits.
Yeah, so there are guidelines about pets that do exist from Fraser Health, at least. So each health authority is a bit different, and I can't comment on all of the health authorities in BC, but I know at Fraser Health there is a guideline there about pet visits, and they are allowed, but there are specific criteria that you have to meet in regards to the pet being vaccinated, behavior, and has to be on leash, and it can only visit that one patient and not to other residents. And I think there's a few other points, but those are the main ones, I believe.
So should the family member look that up on the, will they find it on the web?
The easiest is to ask your care home,
Okay.
and they should be
And they'll know.
well
Okay.
abreast of what the restrictions or guidelines are in their area.
Okay, thank you.
And Marina, I can just add to that too,
Sure.
that thank you, Dr. Tran. The health authorities do have varying opinions on this. And so, and they continue to change as we learn more. So I agree with you. If they can check with the executive director or general manager, we can walk them through that. Interior Health at this time is not accepting pets. Fraser Health has sort of accepted them, and then it's changed a little bit and it's gone back and forth. So we'll look up a little more information with that as well, and we can send that out in our next family communication for everybody.
Sure, that's great. Thank you. There was also questions about flowers and home cooked meals, if those are allowed. I think that the answer is yes on flowers, and Lisa, you're nodding, and home cooked meals, I think if the packaging can be wiped down. Is that correct? Is there anything else you can add to that?
No, that's correct.
Okay, great. And then I think that I just wanted to take a quick peek here to make sure there wasn't anything else that we missed. I think those were the two that really stood out. Is there a limit for how long we can stay for our visit in our parents' room? I think you might have touched on that, Lisa. Is it an hour? Is that the, or is that the requested or the suggested length of time?
Yes, thank you. And I appreciate the commentary in the chat. It's I think we will just ask for a little bit of patience as we work through this. We certainly want to have our families back. We've missed you as much as you've missed your loved one. You know, Dr. Bonnie Henry has asked for a minimum of 1 visit a week and a minimum of 60 minutes. Obviously, if we can do more than that, we will. And again, it really just sort of depends on the need. The other thing is that there's quite a robust process that we must go through with a visitor coming into long-term care, specifically around education that we're mandated to provide and of course want to provide, and ensuring that we also have the contact tracing follow-up as well. So that's why right now we are really sticking to what the order is, but with the hopes of maybe being able to expand that as we move forward into the month of April.
Okay. And the last topic is just around the types of people who can visit. So does it always have to be the same two people who attend visits with a particular resident? And can there be different people attending different visits?
Yes, it can be different people attending at different times. And so this is why we say the volume is going to be quite high when we get started, because we could have an adult daughter and her husband and their child, and an adult son and his wife and their child, two separate groups that want to come and see one parent. So it does not have to be the same person at each time, the same group of people at each time. So this is why we're just going to work through the volume as quickly and as well as we can.
Okay.
I just want to maybe issue a caution. That is one of the places where there's a most obvious difference between the circuit breaker, where you can only have the same people coming to visit you in your home, as opposed to what's happening in long-term care. So that is one place where I think there's maybe a possibility that BC will weigh in and change their mind about something. One hopes not, but I think, the decision about releasing restrictions in long-term care was taken a few days before the circuit breaker happened. And so I think we do need to be conscious of the fact that the ministry in BC might still make some changes to either the circuit breaker rules or the long-term care rules that we'll have to be watching for.
Okay, thank you. Anything else to add, Dr. Tran, before we close out the meeting?
No, I just want to thank everybody for attending the meeting. I know it's been a long haul and people have been very anxious to see these changes happen. And I think we're all glad that they are happening. And again, we just want to make sure that we can continue with these visits. So make sure you're being safe on your end and being conscious to follow all the rules that are in place.
Thank you very much. And thank you to all of our panelists tonight for joining us. It was a really good discussion, and thank you for taking the time to be here to provide all of this information for everybody and answer their questions. And lastly, thank you again, as Dr. Tran mentioned, to all of you for taking the time to come here tonight and hear all of this information. We look forward to staying in touch and continuing to keep you updated with the ever-evolving changes with the pandemic and being able to open things up for you to visit your loved ones. Enjoy the rest of your evening, and thank you once again.
Good night.
Good night.
Good night.
Thank you. Good night.